Good afternoon. My name is Nicole DuBois, and I am a researcher with the Homelessness Research Institute at the Alliance. Before I introduce our next wonderful panel, I just want to briefly mention some of HRI's recent and upcoming research on unsheltered homelessness. Over the past few months, I worked with members of our research network to release 3 short briefs that summarize the extensive evidence of the harms of criminalizing homelessness. In the briefs, we describe how criminalization perpetrates substantial harm to individual and public health and safety, squanders public resources, and only worsens the crisis. We hope these materials are useful to you as you educate the public and lawmakers about how not to address unsheltered homelessness. We also have a few projects in progress that will uplift what is working to address unsheltered homelessness. We'll be spotlighting a few communities that have engaged in intentional strategies, as well as closely following the work of the recipients of HUD Special NOFO to address rural and unsheltered homelessness, so please stay tuned for those. My favorite part of my job is collaborating with you, people in communities across the country who are doing the work to end homelessness. It is an honor to get to learn from you, and I hope that you know each time we reach out with a research request how much it means to us when you take the time out of your incredibly busy days to respond. And so now I'm delighted to welcome this next panel, which will focus on evidence-based strategies to respond to unsheltered homelessness at a community level. Our panelists include Luis Ulerio, appointed by the mayor of Newark to lead the city's first Office of Homeless Services in 2022. Born and raised in Newark, he has over 15 years of experience in government and nonprofits leading housing and homeless initiatives. Carolyn Ross, the president and CEO of All Chicago Making Homelessness History, which leads Chicago's system response to ending homelessness. She has extensive executive leadership experience, including previous roles in child welfare, criminal justice, and treatment and recovery services. Kenzie Strubank, the Assistant Director for Homeless Programs at the Kentucky Housing Corporation, where she leads the homeless programs teams and the Kentucky Balance of State Continuum of Care. She began her work of ending homelessness in Kentucky 16 years ago with positions in a domestic violence shelter, permanent supportive housing programs, and coordinated entry. Claire Herbert, an associate professor at the University of Oregon, where her research focuses on law, housing, property, and urban sociology. She is currently writing a book on unsheltered homelessness in America. Seiron Fu will moderate the panel. He leads the Conrad and Hilton Foundation's programmatic and advocacy goals in realizing a Los Angeles where homelessness can and should be rare, brief, and non-reoccurring. He previously held roles in public policy and philanthropy throughout California. I've had the pleasure of working with each of these individuals and communities through my research with HRI. We asked them to join us today because, as Steve said at the top of the plenary, today's theme is tactics. Our aim over the next half hour is for you to hear ideas that inspire you, ideas that you can take home and implement in your own communities. And so, please come join us.
Good afternoon. Right, so our panelists are going to join us on stage. Thank you, Nicole, for that warm introduction. It may be the only thing that is warm in here at the moment. So some of you may wonder why it's so cold in this room today, and I just want to introduce you to the cast of Frozen 3 standing here before you. So I have to ask you all, do you want to build a snowman? No, seriously, it's inspiring to hear people like Assemblymember Bryan and Senator Perez. I'm fortunate to live in a state where we have leaders such as the Assemblymember and Senator, and there are extraordinary individuals across the country, some of whom are here today on this panel, who will share the tactics, translating the research and the political will into real solutions. To ground us in our conversation today, the first question will go to the author of all those resources that you just saw Nicole share, and that's to you, Claire. Can you ground us in evidence and tell us what's working in response to unsheltered homelessness?
Absolutely. So in some ways, I feel like I'm, preaching to the crowd here. Probably know a lot of this from your experiences working on this problem. But I'm going to talk a little bit about what we know works, and I'm also going to talk about what we know doesn't work and what we need to stop doing. So despite a recent Heritage Foundation report calling for an end to housing first, we do have a wealth of longitudinal research that shows that prioritizing low-barrier housing is largely successful at keeping folks housed. Even those who have been experiencing chronic homelessness, these efforts also reduce government costs in other arenas, right? It saves us costs of policing, other emergency medical services, emergency room budgets, and other government departments that are increasingly involved in the maintenance and regulation of public space, which is where unsheltered people are often living. We know that rapid rehousing is crucial for preventing an early instance of homelessness from becoming a case of chronic homelessness, because it's when it becomes chronic that obstacles to housing really escalate. We know that outreach workers who work to establish trust with unsheltered communities are much more successful at connecting people with resources, with getting people housed, than the police. We also know that low-barrier shelters are a great way to get people inside, right? When pets, partners, and possessions are allowed, people are much more willing to move inside. And we also know that the rise in unsheltered homelessness is not because folks are choosing to be homeless, but rather that every year across the country, we are short an estimated 200,000 shelter beds just for adults every night. So what doesn't work, and what actually prolongs and exacerbates unsheltered homelessness, are various forms of criminalization that we're seeing ramp up across the country. When encampments, both tent and vehicle encampments, are displaced, these engagements with the criminal justice system cause sort of upstream and downstream effects. When people are sent to jail even for a couple of days, they lose jobs, they lose their possessions. And we know that having a criminal record makes securing formal housing much harder. We also know that unhoused people are largely unable to pay the fines, as you just heard from our previous panelists, but that issuing these citations costs our government a lot of money. Even without criminal justice involvement, though, what I hear a lot in my work is police who are trying to gain compliance. They don't want to issue tickets, they don't want to arrest people. But even when that kind of criminal justice element of it is absent from displacement, we know that people are harmed, especially their health, their safety. So research shows that unsheltered people are more likely to move to dangerous spaces when they're displaced. They're increasingly at risk when they have to move. They lose their belongings, they lose IDs, computers, medication, other health equipment, and losing these possessions makes daily life harder. It makes exiting homelessness more difficult. Forced moves disrupt people's ability to find and maintain employment. We know that a lot of our unhoused people are employed, they are working, they're trying to save money to exit homelessness. And when they're moved, oftentimes they lose their jobs as well. Sometimes it's the stress and the time and the labor of moving. Sometimes it's because they lose access to transportation that would have allowed them to get to work. Displacement also disrupts community ties. Encampments are oftentimes communities, and those bonds are really important for people's survival and well-being. Displacement also makes it harder for outreach workers to find folks and keep them connected with services and help them get into housing. People experiencing unsheltered homelessness, police, and other government workers who interact with them increasingly call encampment removals a game of whack-a-mole. They're temporarily displacing the problem from one sidewalk to another, from one neighborhood to another, and from one government department to another. Government workers are frustrated with being tasked with clearing encampments. It's a significant waste of resources, and we are essentially funding the continuation of homelessness rather than its resolution.
Thank you so much, Claire. So I have not been gifted with the ability to do research. And so one of the things, if you're like me and you just listen to Claire, you might be going, that's a lot. And how do I digest all of this? And one of the things I so appreciate about the Alliance and Claire is we take research and it doesn't sit on the shelf, because there's a lot of research just sitting on the shelf that we all know collecting dust. And so we have 3 extraordinary panelists who will talk about that research and translate that research into practice. So I'll turn it over to you, Carolyn. Let's just hear from you about the tactics. What's working? What have we learned in Chicago, from your experience in Chicago?
Thank you, and hello everybody. It's good to be here with you. I must say to our California partners, I was a little disappointed. All these people here, we didn't have a red carpet for them to walk in on. I see you and you're appreciated. In Chicago, don't pay attention to what you hear on the news, because we have such hardworking partners that have come together to try to address this issue, to try to make sure that we're meeting the needs of people who are facing homelessness or experiencing homelessness. So when we pretty much got surprised by the pandemic like everybody else, we challenged our staff and our partners to start thinking outside of the box, because it very quickly felt like we were going to have to start thinking differently and create things differently. We have great partners in Chicago. Some of them are here today with our city partners, our funding partners. And so when we don't have a solution, we've been able to come together, put our heads together, and figure out how to get through it. And so the thing I'm most proud of is we have tried to learn from those things that we've tried, and we've been able to pass some of the things on with all the lessons that we learned from the research that we've had partners with to look at the works that we're doing here in Chicago. And it kind of morphed into what's helping us the most today. Really finding ways to meet people where they are, be able to develop new resources or resources that haven't been touched before to make sure people can get connected with housing. The Housing First model has been a very strong idea for us to build a lot of our services on. And Chicago has really done a pretty effective job of trying to meet the needs, despite the pandemic, despite the ongoing visits by new arrivals, despite even politicians and folks saying, this is a problem, why aren't you doing something about it? And so it's important for us to keep talking about this, and I am a strong believer that the needs of people are ever changing. We need to stay on our toes and be able to respond to those changes as they come up. No judgment, no bias, receive and start serving people from the point of where they are.
Thank you, Carolyn. And apologies about the absence of red carpets. They're all being used this Sunday for the Oscars here in LA. So let's go a little bit south of Chicago to the great state of Kentucky. And Kenzie, share with us your experience. What are the tactics, particularly given the different geographies and different types of communities that you're leading in Kentucky?
Thank you. Good afternoon, everyone. I have to start out with saying it is an honor to be here and to discuss unsheltered homelessness, particularly for our continuum of care. Kentucky is one of the poorest states in the country. It lacks infrastructure locally around the state from corner to corner. We do not have enough resources. So as you can imagine, our homeless response system mirrors that. And I don't think my team and I ever thought that we'd be on a stage discussing our tactics and strategies to address unsheltered homelessness to begin with. So historically, Kentucky as a state has a pretty weak shelter system, funding-wise and capacity-wise. And so we kind of lacked, up to the pandemic, an accurate front door to our system. Street outreach was not a thing that we did or were able to fund at all. We don't receive any state money in our annual budget to support shelter operations, so we are solely relying on ESG funds in our state, in our system, to operate shelters. And so if those of you out there receive ESG funds, you know that formula is not great and you're not getting the funds that you need. So we have approximately $2.5 million that we get annually in ESG to support over 35 organizations around our state. We represent 118 communities, counties in our state, and it is just not enough. And so with the pandemic coming, I think our system did a really great job of being bold, being innovative, taking big risks, doing things like funding street outreach. What? We're gonna go outside, we're gonna find people, we're gonna create that front door to our system that our shelters cannot address, and we're gonna find people. And it's been a wild ride, it has been a worthwhile ride. We have 100% fully funded street outreach in our 15 sub-regions now, which we can talk about a little later. Thank you. And we finally have data. We finally have data. We didn't have data on unsheltered homelessness before that. So that's really helped us see where our gaps are, and it has allowed us to mobilize and continue to mobilize. We've spent essentially the past 5 years focusing on system preparedness, and system preparedness for infectious disease at the time, and now for the extreme challenges that we face both as a state and as a country moving forward.
Thank you so much, Kenzie. And now we'll jog a little to the east, to the great state of New Jersey. Let's share more about what you're doing in the city of Newark.
Yes, so I just want to say I have a 10-minute walk here because I'm in another hotel, so I regretted wearing a wool blazer, but I was sweating on the way over here, but boy, I'm so glad I have this wool blazer. I am freezing, at least my hands are. Thank you again for having us here. If you haven't been to the city of Newark, you are welcome to visit. We have great people, great culture, great restaurants. So let me know, text me if you're in the area. So in 2022, our best tactic is strategy, right? So in 2022, our mayor launched a comprehensive plan to end homelessness in our city that centers around 3 strategies, and one included reducing and better addressing unsheltered homelessness in our city. And in year 1 of the plan, we literally hit the ground to work on ways to better engage and serve our residents. We strengthened our street outreach, which is really a key component, expanded emergency housing by 30%. We actually identified a vacant hotel that we're able to provide 275 beds to our most vulnerable. Brought together all the partners, right, across the ecosystem, government partners, state and county levels, and also our community partners, right? So EMS, police, public works, right? Mobile crisis teams and others to discuss how to better work with each other. We also improved our data collection and reporting, which helped us, of course, better understand the population and to better, develop better solutions. So these quick actions and, community mobilization helped us achieve great results in year 1. We were actually able to reduce street homelessness by 57% in that first year. But the story doesn't end there, right? We all know that it's a moving target. So in year 2, we actually began to see some of those gains being taken away by inflow, right? Because there's always inflow and outflow. So we decided to do more in 2024. We opened a 24-room transitional housing community on city land that converted containers to beautiful residential units with many, many amenities. We launched a texting service for the public to use. Right? We wanted to engage the community wide, right? So anyone can identify someone, send a quick text. Those texts are sent to our street outreach workers who then respond. We also had a major expansion in street outreach efforts. We went 24/7 for the first time ever in our city, added clinical teams, street medicine teams, and more outreach workers, of course, on the ground. And we ended 2024 with probably the most groundbreaking project we've seen, is a partnership with the local housing authority to designate over 200 vacant units for chronically homeless residents. They're vacant and need a repair. The city of Newark, released a municipal bond of $6 million to repair the units. and designate them for our most vulnerable. They are living on the streets or in our shelters. So we've responded in a big way, but it's, we're not done yet. We're moving into 2025 with other projects as well. We are creating an 8,000 square feet drop-in center. We're adding an additional transitional housing community we're calling Resilient Hope, a hotel conversion project, and other initiatives that we have in plan. So we're really excited about this work in our city. Thank you.
Thank you, Luis. So not everyone's going to have a Assemblymember Bryan or a Senator Perez representing them in their state legislature or in their local jurisdiction. And I'm curious to hear, and we'll work backwards this time. So Luis, I apologize, you have to go twice in a row. But how are you managing to build political and community will for some of these solutions? And also, because you mentioned both multiple prongs of the strategy, how are you holding the tension about needing to build more interim housing and permanent housing? And that for elected officials, the desire to address unsheltered homelessness in the present often means putting more resources into interim housing, when we know from an evidence perspective, over the long term, that's not an efficient allocation of resources. So that's for all three of you. And curious about how you're building political will and holding that tension and balance of more interim and more permanent housing.
Yeah, I mean, it's about, creating urgency around the issue. I think we all agree we have urgency in here, right? But how do you communicate that and deliver that to the community, right, as a whole? And it really starts with leadership, right? Our mayor really, released a plan. It was a call to action to invite all members of our community to contribute to this. The plan itself that we released in 2022 is titled The Path Home, Collaborating Across Our Community. So we purposely put that in there. And in Newark, we believe in lifting heavy issues together, right? So if something is too heavy, you ask for help, whether that person is bringing strength or leverage, right? You'll need them to lift a heavy object. And it's exactly what we did in Newark. Many partners from various sectors stepped in, answered the call, joined the work to align their efforts to support the plan. Some of our most impactful partnerships actually have been public and private. They actually helped our efforts by increasing our capacity, raising funds for new programs and initiatives in the city, and of course, right, we all need this, right, technical assistance. I would just want to offer some of those examples of partnerships. We have the Newark Alliance, which is a nonprofit in the city of Newark that for decades have brought together and collaborated with leaders from business, real estate, health, and other institutions to work on economic development. But they actually pivoted and decided to support the mayor's plan once it was announced. And through this partnership, we were able to kind of unlock private dollars to support our work. Most recently, they raised funding for us to launch a new clinical metro team that deploy a psychiatric nurse practitioner and a social worker in hotspots in the downtown area. I want to give a shout out, of course, to state government, right? So the State of New Jersey Office of Homelessness Prevention, who might be in the room as well. They've been a great government partner in this effort. Their team has provided deep data analytics, helped us create and train a data analyst in our office, and strategically, right, funded programs that directly impacted our work. So another great partner of ours that really contributed to this work. And the last partner that I want to shout out is Bloomberg Associates, which is part of Bloomberg Philanthropies. They have been a partner since day one, has provided, and Christian, who might be in the room as well, has helped our office develop the plan, carry out strategies, and really measure our work. And we really would not be here, gotten this far if it wasn't from the support of public and private partners. And so we're thankful. No city can do this alone. No partner can do this alone. It's going to take all of us, including private partners. So we got to tap into that private investments as well.
Kenzie, over to you.
So Kentucky Housing Corporation, my organization, is the state housing finance agency for Kentucky. We are a super large organization. We have several hundred employees. And I like to joke, we are uniquely positioned for greatness. Doesn't mean that we always were uniquely positioned for greatness, but we are in this space, in this moment, which we are so lucky for. So in addition to all of the homelessness work that my team and I do with our partners in collaboration, we're a funder, and that's been really, really helpful. And we don't have to argue with anyone but ourselves in Kentucky, because we are lucky enough that we are over the Emergency Solutions Grant, the home program. We're the largest COC recipient that we sub-grant out. We do HOPWA, and we also happen to be the largest PHA in the state in another department at our organization, where our regular HCV program oversees 87 counties, and then we have 3 specialized HCV programs that are geared towards ending homelessness, and that's been expanded to serve all 118 counties of our COC. We also were super busy during the pandemic. We received the CARES Act award for ESG. We received all of the EHVs for the state. We received the ERA 1 and ERA 2 funds, as well as the Home American Rescue Plan Act funding. And so we were in a really fortunate place by the time the world felt like it was ending in 2020, because we had worked out some of the kinks between the different departments within our organization, and really centered on housing everybody in every which way that we can, whether it's through our LIHTC, whether it's through homeless programs, whether it's through our PHA side. We're all very centered on the mission of getting people into housing and keeping people housed. And so with that internal partnership, which sounds like it would be easy to do in an organization, if you work for a large organization or a small one, sometimes it's not. We were able to make, like I had mentioned, really bold decisions and took really bold risks in our strategy to address all the gaps within our housing continuum system and our homeless response system. So those partnerships led to creating a team of people that are on the ground every day doing direct service for the first time in our organization, which is a quasi-state government organization that typically doesn't do that type of work, to connect people who are street homeless to our specialized housing vouchers. We were able to allocate millions of dollars towards a rapid rehousing-like type of program, specifically with our ERA 2 funds, so that when the CARES Act money was gone, we still had that capacity in place. We were able to get buy-in from our development side of our team to use some of our Home American Rescue Plan Act money to fund specifically street outreach for when the CARES Act money was gone, and that was before the special NOFO was the thing that we knew about. So we were able to leverage all of our funding sources and all of our areas of expertise throughout the past 5 years to get us to where we are today. But of course, we have amazing partnerships with all of the agencies that we support day in and out. We spent a lot of time throughout the pandemic, like really cultivating those relationships. We are a very hands-on, I think, COC lead organization. We also love to be together. If you've ever been to a conference with the Kentuckians, we really love each other. We really believe in community. And so funding is one thing, and partnerships is one thing, but I think what we've done a really good job with is like true collaboration and building rapport and building trust and taking risks together, right? And making sure that the organizations that are doing that frontline work feel safe and supported. Most of the people who work on my team are former direct service providers, like in the days where we argued about housing first originally and coordinated entry originally. And so we bring that perspective to the work that we do, and we work for our communities and our organizations. And I think that that level of internal and then external buy-in has really allowed us to keep up that momentum that we started in 2020 and has really accelerated and advanced our work together.
So when we talked earlier about All Chicago's role, I mean, we're the system lead. We also are the lead with the HMIS system for data collection and management, and as well coordinated entry. And the coordinated entry just kind of came in within the last year and a half. But because we had those pieces and our partnerships, we found ourselves very uniquely positioned to get innovative and to start pulling together those resources to make sure that we were making the greatest impact with them. So we've met frequently with our city partners, our state partners, and our private funding partners, our provider partners, to make sure everybody is aligned and on the same page to know that we're going to focus on these things. And so Chicago was very fortunate in that we first we received the Unsheltered, we were a recipient of the Unsheltered NOFO to really kind of up our game a little bit on our unsheltered homelessness. It allowed us to do some of the very similar things you all mentioned, expand our outreach to make sure that we were paying attention to areas that were either underserved or we hadn't distributed the resources well. So we set up a sector system by zip code and using that information from our system to decide where we could plant things. And as well, we were also part of the All Inside initiative. Chicago was one of the cities that was selected to be a part of the initiative launched by the United States Interagency Council on Homelessness. All that being said, our job was to be kind of like a conductor to make sure everything was in place, because we are staunch believers in that we cannot do this work alone. And so at the state level, in 2021, our governor pushed and established the Office to Prevent and End Homelessness on a statewide level. We have a statewide chief homelessness officer. In the last year, kind of learning from that, our philanthropic partners worked with the city to create the position of the chief homelessness officer. And so we have those supports, as well as our strongest partner at the city is the Department of Family and Support Services. They manage ESG funds, for example. Our goal was to learn what they know, to know what was coming in, and to offer our assistance to one, do the process to identify those resources, identify partners who could take on those roles, and to be able to service. So with the Unsheltered Homelessness Initiative, we were able to expand our outreach teams. We created 7 new outreach teams. Of course, it's a very pressing issue for me on our black and brown and purple and green and all those people. The point is, we are so familiar with the concept of division. And because we label people so much, we lose sight, or some of our folks lose sight, of the real issue is, forget all that other stuff. The common issue is that they're homeless, they're unhoused. And so when we began to really get our partners to focus on that, it was less of a distraction. And so through that process, we also created an initiative. First, we started with expedited housing, because we wanted to shorten that time from the time people enter the system to get housed. And then we did a white paper on it. We sat there and we looked at the data to see how effective it was. We were able to shorten that time in a particular year. Because one thing we know for sure, the beginning of last year, the first 6 months, for every one person who entered our system, that was housed, every one person that was housed, 9 new people entered the system. And so you can't get overwhelmed with that. You got to get on your guard and start replanning it to make sure we're hitting those resources. One thing we had put into place from the expedited housing is we created accelerated moving events. They're very popular. Why? Because they work. Last year we did over 30 AMEs, and basically I call it one-stop shopping, but we will set up a day in partnership, the city, their outreach teams help us identify areas that people were needing services, encampments. For example, we also try to protect the privacy of those who have been victims of gender-based violence or domestic violence. We don't bring them out in the open. We go to where they are and have those type of events. We have our partners there. We bring in other resources to help them get identification, to help them, one, look at different places of parts of the city they want to move to, give them 2 choices. They select that day after their application is completed. We have furniture partners who help make sure that they have a full move-in capacity to get that done. And it's a real feel-good. It's about bringing attention to folks that we do care, and that when there's that opportunity, we're going to serve it. So it's popular because everybody wants one. And it's not intended to clean out encampments. It is a housing event. And that's part of the piece when you ask about working with the political will. We look at it as community will, getting people to understand what we're trying to do here and join them to be a part of that process. So we're real proud of those types of initiatives, and we'll continue them on as we move forward.
Thank you, Carolyn. Well, our time is up, and I know we're the barrier to lunch, so we will wrap up, and 10 seconds per person, and I will count and cut you off. I'll ask the folks to cut off your mic. 10 seconds. What's one piece of advice you want to share with the audience as we do this work? Claire, we'll start with you. We'll work your way down. 10 seconds. One piece of advice.
Homeless policy is housing policy and vice versa. We cannot implement housing first if we don't have enough housing to put people into. So we need to be collaborating across those different sectors.
Carolyn?
10 seconds. Okay, 8. So I think the important piece is keep your head up and keep moving forward. It's really important because people are counting on all of us to help them and to get them housed. They're counting on us. Take care of yourself so you can be the best you for them, and keep trying new things.
Kenzie?
I would say lead with authenticity. Do not be afraid of the word no. Ask for what you want. Keep asking for what you want. Own your own narrative as a system, and you keep at it until you get through whatever red tape you might have, and you get the work done, and you don't stop.
All right, Luis.
I will say that if there's no sense of urgency in your community, you're going to have to create it. So use stories, use data, make noise, engage the city, elected officials, your community, and make a lot of noise. Folks are going to pay attention and they're going to follow.
Thank you, everyone, for your time and attention. Thank you to our panelists.
Thank you for that.